my name is Gianna Lianas. I'm a radio DJ, TV host, sports reporter, and beauty queen. Today I'm back at CSA Medical Aesthetics, this time for HIKO nose thread lifting and fillers. I've actually always really loved my nose, but of course wanted to enhance it a little bit. So I'm so happy that I found the non-invasive procedure here at CSA. And I actually did the exact same procedure a few years ago because I found it through YouTube videos like this, where Dr. Contessa really talks you through the procedure and shows you the effects of it, that it's pretty much painless, it's nice and quick, and you get the results that you want almost instantly. Now, since I did do it a few years ago, of course, the procedure is not permanent, so today I'm going to have a little bit of an update on it because I'm getting more TV work, on-camera work, where I, of course, want to highlight my nose. So that's exactly what I'm going to get done. I believe I just have to get some anesthesia, and the procedure is super quick. I remember when I first researched it, it was actually advertised as something you can do during your lunch break or right after work, and then you're out the door. And the recovery process was really quick as well. It was pretty much painless, and I saw the real results of it after a couple of weeks. So I'm excited to get it done again today, and I'm inviting you to come along with me through the journey if you're interested in doing the same procedure too. Don't forget to like and subscribe to this channel. Also comment down below if you have any questions, and click on that notification bell for more videos.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll have a follow-up of Gianna Lianas. Welcome back, Gianna.
Thanks for having me again, Doc.
Yeah. So we did like a couple months ago, like thread lifts on your face.
Yes.
And how was it?
It's great. I saw the effects almost immediately. I think yung pinaka nakita ko is a month after. I saw a lift in my face. Even my makeup artist said that she saw parang mas naging fresh ako.
Exactly. And like your skin was brightened also.
Yes.
And really refreshed.
Yes.
Younger looking. So this was just like how many months already? So parang 4 months ago,
yes,
right?
4 months
so
ago.
You'll see more of the results actually because the threads are still there and they're giving this neocollagenesis, neovascularization, brightening, tightening, firming, and a younger look, right? So it's like so natural.
Yes, I love it.
Right.
I love it.
And for today, we'll be doing a booster treatment for you. It's the so-called HIKO Booster. So we have now this kind of treatment whereby we do a repeat non-surgical nose lift for our clients before. And this is like adding on top of what we've done in the past to like build a second layer of tissue build up. Something like that. So like I think 3 years ago.
It's 3 years ago, yes.
Yeah, we've done this non-surgical thread lift for you.
Yes.
And for today, we can do another.
Yes.
An add-on or like another layer of our PDO threads for Gianna. Do you have any concerns before we do the procedure?
No concerns naman po.
Yeah.
I think it's good. Yeah, I mean, last time it didn't hurt that much. It was really quick, so I think I'm okay.
And you're still up to do this bridge lift and tip projection non-surgically.
Yes.
Yeah. Because, well, we have people who are still not planning to go under knife or have this surgical cut. Some people are still afraid of surgery. Some people don't want to have general anesthesia. Because with the surgical rhinoplasty, of course, you have to go to sleep or they'll have to put you under general anesthesia. Some people don't like that. Some people don't want this like cutting and a very long downtime.
Yes,
Right?
yes.
Especially Gianna, you're so busy, right?
Yes, yes.
Yeah.
Well, and I am still a little scared of surgery, so I think this is perfect.
And the thing, of course, surgery is, well, they were saying, I want a permanent result na. Okay, that's understandable. The thing is, for some people, there are others who underwent surgical rhinoplasty wherein there were like rejection of the the implant, something like that, or the implant came out. And then they have to do revision rhinoplasty. So once you start with surgical rhinoplasty, there are chances that you'll have revision rhinoplasty. Well, it's good. The surgical is good, of course. It really gives that perfect shape of the nose that you want. And you can alter the shape, you can alter the anatomy of the nose. But for some individuals, they just want to still retain their natural anatomy, their natural looks. Just like me, I am still like, I don't want the surgical rhinoplasty on myself. Okay? I just want the natural one and retain my identity.
Yes.
So we're doing a HIKO booster for Gianna today. So we'll watch that when CSA Medical Aesthetics return. And we're back, so we're now going to have a so-called assessment of the nose profile, okay, for Gianna, okay, checking on the radix height. So this part here, we can still improve the so-called nasofrontal angle here. Ideally for women, it's around 130 degrees for this angle here. And then going to this lower dorsum of the nose or the distal portion here, so I noticed a little bit of a so-called supratip break. And then when we go to the tip defining point here, so we have a rounded tip. And it's common among Asians, right, Gianna?
Yes.
So rounded nose tayo. And then going to the columella there, okay, so far when you look at the side view, the profile, there's this 90-degree angle. Ideally for women, 95 to 105 degrees, so a little bit of upturning. So those are the ones that we need to work on. So improve nasofrontal angle as well as the columella labial angle here. And of course, reduce the change the shape of the tip. So from a rounded to less rounded, okay? And then also improve the supratip break. And checking on the so-called intercanthal width. So far the alar width is good. It's within the intercanthal region. Again, for doing the non-surgical nose thread lifting, we have to make sure that we place the thread in the right anatomical plane, and we have to avoid danger zones or danger areas. There are vessels surrounding the sides of our nose. So since we're doing thread lifting, it's safer. Unlike with our nose filler, we're very, very cautious when we use our nose filler. Okay, so I just saw right now that there's this scab on the dorsum of the nose, and I asked Gianna that because she just had like a pricking of the acne there, but it's already drying up, because when there is an active acne lesions, that's a contraindication, meaning to say there's an infection. So for now, it's already dried up, so it's fine to do the HIKO booster. So for our non-surgical method, of course, we have to start with cleansing the area, disinfect the area, and then we applied topical numbing cream a while ago. We left it for like half an hour, and then we'll also do an injection of our anesthesia. And I have an entry point here. So for my entry point, I can still inject a bit of my lidocaine. So I'll be doing anesthetizing using a cannula later on to anesthetize the entire nose length. So this is like the tip entry point. So just a tiny needle and push a little bit of your lidocaine. So done with our lidocaine injection using the cannula method. So I'll now use the PDO threads for our bridge augmentation here. So I'll pinch the tip and pull it up and glide this cannula containing our PDO threads. So gliding towards the radix there. So just inserting inside. So considering this is a HIKO booster, so we know there's already a resistance inside. That's expected. Okay. For my repeat injections of threads, the number of threads that we use will vary. It depends, case-to-case basis. So some would need fewer, some would need more threads depending on the anatomy of the nose. So this is my 4th. And for Gian, we can use up to 5. And then last for the bridge. And then after that, we'll proceed to the tip columella projection. For my tip projection, I'll be using another entry point for that one. Okay, so far so good, Gian?
Yes.
Yeah. So for my definition of this nasolabial angle, so I'll use a PDO thread also with a shorter length. Okay. Now grasping the columella to go towards that part there. Okay, pulling out. And another one. For this part here, the number of threads that we use will vary on this intercrural space. Some we use 2, some we use 3, up to 5. So depending on the available space within. So for Gian, we can use 3 to give a more definition and slimmer nasal tip. Okay, so we have done our HIKO Booster for Gian. We'll show the result when CSA Medical Aesthetics return. And we're back. So we're done with the HIKO Booster for Gian. And let's show the result. Here's our mirror, Gian. Ayan.
Wow.
Instant result, right?
Yes, yes.
And we just used PDO threads only. We did not do the combination filler and threads. So for Gian, the repeat treatment was purely our PDO threads. And we did the dorsum augmentation or increasing the radix height plus the tip projection and the improvement of the columella labial angle. Feedback, Gian.
I love it. I love
Right.
it po, Doc.
Yeah.
I love the tip especially kasi yun po yung insecurity ko.
Exactly.
talaga.
Less rounded na siya.
Yes, yes.
A while ago, it was really parang broader
Mhm.
yung tip mo. Right now, it's narrower because of that projection.
And it fits my face. Yun po yung scare ng mga
Yeah.
tao, I guess, when getting something done with their nose.
Mhm.
Baka sobrang iba yung itsura. I
Right.
feel like it's me, but it's an enhanced version.
Exactly. Para ka lang
Yes.
nag-nose contour line on makeup,
Yeah,
right?
so nice. I'm so
Yeah.
happy. I'm so happy.
And looking at the profile view, so there's already an improved nasofrontal angle, and then the tip defining point is a lot better, and the nasolabial angle is also upturned already, or like there was this rotation upwards. And this part, the super tip break, is gone already. There's no more of the dent here because of those volume threads that we placed. So for the kind of PDO thread we use for our nose, we use those volume threads, the thicker PDO thread. Okay. And it's instant, it's so natural and very safe. Okay. So we were just careful with that scab there, although it's already dry. So after the treatment, we'll prescribe you with some oral prophylaxis, so antibacterial plus analgesics,
Okay.
and then we'll give you a list of do's and don'ts lang.
Okay.
Yeah.
Great.
So this
Thank
is a
you.
quick procedure. It can be like a lunchtime treatment or a coffee break treatment, something like that. You come out with an enhanced nose. And take note that so far the effect of this non-surgical method, somehow it lasts years. So our repeat is 3 years,
3
no?
years ago, yeah.
Right. Because mine too, I still have the threads.
Mhm.
I've done it like 3 years ago. It was just all threads, no filler. But I can still feel the presence of those threads there. The effect of tissue buildup or neocollagenesis. So neocollagenesis, neovascularization, and then tightening of the skin, and the skin on the nose is improved. Parang the pores are gone.
Yes,
Right.
I feel it. I see
Yeah.
it too.
For some of my patients, they were sharing with me after the treatment. It's just like their nasal tip became oily. And I was explaining to them, because you place this PDO threads, it's working on the sebaceous glands, on the oil glands. It's like creating like squeezing those oil glands, and somehow it helps in reducing those fat glands, because the PDO threads also have an effect of like a lipolysis effect or lipolytic effect, so giving that narrower and slimmer nose. So for those who are really not into the surgical method, this is like a best option for you guys, It's really safe. It gives you a natural result, and people can still recognize you. Still Gian, right?
Yes, yes.
Yeah.
I love it though. Thank you.
But of course, Gian, we have people na they come to us. For example, we still assess them. Some individuals whereby we look the nose anatomy, there will be individuals that will really need a surgical method. So it's a case-to-case basis pa rin. And then we refer them to our surgeons. Yan. So, any message to our televiewers, Gian?
Well, I'm sure like 3 years ago I actually found this procedure on your YouTube channel as well. So I'm sure so many people are interested. I hope through this video you saw how the procedure is. It truly is painless and it's quick. And it's a perfect way to enhance your nose while also embracing your natural features. So thank you so much, Doc.
I like that, embracing your natural features. Gian, if they have questions, sometimes some of our televiewers would want to ask questions to our models, to our guests. Can they like DM you on your social media?
Actually, the last time you did my threading, I got so many questions about it.
That's great.
So I'm sure so many people are also going to ask about this procedure. You can check out my social media accounts. It's all at GIANNALLANES, Gianna.
You can email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And those who have missed the previous episode, the video of Gian, you can look at our YouTube channel, Contessa Salvador Alapag. And please subscribe and click the like and notification bell. Okay, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.